Good afternoon. My name is Sally Jeans, and I'm going to be talking for the next 15-20 minutes or so about Rudy, but from a patient's perspective. So, as you can see very briefly, to start with, Rudy is uniting patients and researchers to investigate rare diseases. I am a patient at the Churchill Hospital in Oxford, having been diagnosed in 2017 with multiple myeloma, which is bone marrow cancer. I joined Rudy about 18 months ago, and I have asked quite a few other multiple myeloma patients and users of Rudy for their feedback on their patient experience. So hopefully I'll be able to give a reasonably accurate description and representation of what it's like as a patient using a registry. I think the first thing I need to do is add a caveat that I don't know anything about any other of these rare diseases. I don't know anything about the nuts and bolts and stuff that goes on behind the scenes. I'm going to purely be talking about it from a patient perspective. Rudy stands for the Rare Undiagnosed Diseases Study. It is a patient registry, any disease that affects fewer than 1 in 2,000. And it is here to inform research by using data input only by patients and to improve patient and public involvement in research. Who is Rudy? Collaboration of patients, families, health professionals, lawyers, and computer programmers. So, coming on to what is important to patients. I think this was mentioned earlier on. It needs to be really user-friendly. It can be quite time-consuming, and not all patients are well all the time, obviously. So, easy to complete. I think we saw that in the pain questionnaire. Lots of preloaded information, just a sliding scale. Not too time-consuming. One of the advantages is that you don't have to fill in all of those questionnaires in one session. You can take as many sessions as you like. So you could come back to it 4, 5, 6 times, depending on your availability. There is consistency. You could see across the questionnaires, they all looked very similar. When you click on the questionnaires, there is consistency across the interface. Quick response time to questions, which I think is really important. If you're halfway through completing a questionnaire, or especially at the beginning, giving your consent, setting up your profile, you just want to get it done. So it's not working, you've read the things in the library, need to ask somebody. And it's really important that you get a response very quickly. You can download and print off the information, which some people like to do. And also for me, I thought it was really important that the website had a very professional and authoritative look. So when I was deciding, having a look around Rudy, shall I join up or not, the one thing that helped me to decide was in association with. Myeloma UK is the charity which I have had quite a lot to do with and which I have a huge high regard for. So the fact that Myeloma UK is happy to be associated with this study gave me the confidence to sign up. So how is it useful to patients? You can keep track of and compare your disease over time. I think they showed that in the timeline. Your data is all in one place. I know that whenever I go to clinics, I take my big file with me, which is all sort of in chronological order of whatever letters and information I've received. However, you can have it all together thematically. For example, your medications in one place, information about your bone marrow transplants perhaps in another, so that's available in a more accessible format. And I think especially if you are not in your own clinic, if you're on holiday, you're taken ill, the fact that you've got all your data here available online could be very useful. As long as you've got an internet connection, it's available anytime. And very, very importantly, having asked a few patients what they find the most useful, overwhelmingly patients want to contribute to and benefit from research. However, there are a few issues. Having just said it's quite quick to complete, I'm sort of contradicting myself by saying it's time-consuming. It's only time-consuming in the sense that when I showed you the pomidronate, you think, oh, I'll just click pomidronate, right, that's me done. No, you click pomidronate, you get quite a few more questions you have to answer. You think you're going to take 2 minutes to finish this questionnaire because it's just click, click, click. Actually, it leads you on to more questions. And one of the largest criticisms I've heard from other patients is that if they've been diagnosed with this disease for, say, 5 or more years, they've got a huge amount of paperwork. The questionnaires want you to fill in the day, the date of treatments. You've got to rifle through all that paperwork, and that puts people off. They stop doing it, they give up, they go away, they come back possibly, they might not come back. Rudy looked at this and decided that the best way was just, for example, I started pomidronate in 2015. A year would be enough. So they are working with patients to make it as easy as possible. There are lots and lots of questionnaires when you open that page, and that could be quite daunting for people. And especially in the more vague areas such as quality of life, there does seem to be some repetition. And now I think, I'm not sure because I'm only a patient, that one of the reasons for this is because the questionnaires are coming from different research groups. They're asking slightly different questions. So it might seem that there's a repetition of questions, but they're being used for a different purpose. Again, I said there was consistency. There is consistency across the interface, but within questions, within the questionnaires, there are some discrepancies. For example, some questionnaires say, complete these questionnaires given your, the information over the last 2 weeks. Others will say, over the last 4 weeks. Others could say, over the last 2 months. Rudy says, please read the questions very carefully. But again, we come back to time. As a patient, you want to go click, 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 click. And I know that I have not read all of the details at the top. I just put in my data. This is quite an interesting one in that Rudy is promoting an online diary. I don't use it, and I don't know anybody who does. So sometimes there's a mismatch between what the organisation think is really, really useful and actually what patients find useful. Perhaps it's because I'm of a generation and generally multiple myeloma people are a little bit older and therefore not used to using apps and websites for their data. Perhaps this will change as we move to a paperless society. Another important area is getting feedback on how your data is being used. As I mentioned before, the research element is really, really important to patients. From the data that is uploaded, they formulate research questions. It would be really good to have an update on, we are using this data for this project. Even if the project hasn't started or is not up and running, we're employing a new member of staff in 2020, and we will have this up and running in 2020. So as a patient, you spend quite a lot of time uploading data. 6-monthly reports on how your data is being used would be very helpful. Rudy also allows patient involvement, so rather than just sitting at your laptop typing in your data, you can join a patient forum, and you're invited to meetings and workshops. And I must admit, when I first went along to one of these workshops, I wondered if it was just merely a tick box exercise. NHS wants PPI, patient and public involvement, and oh, we've got a patient in the room, tick. But it isn't. Rudy is very much patient-driven. They listen to us in the patient forum. At the last meeting I went to, they devised a research proposal based on what the patients in that room wanted. So finally, I need to say a very big thank you to the Rudy team. They are very small. They do an awful lot of hard work, and as a patient, we sometimes forget all the hard work that there are people like you behind the scenes are putting in. But the very fact that we are all working together, all trying to get a cure, I think there is not a single multiple myeloma patient who would not say that finding a cure for our disease is what we want to see. Thank you.